Hello and welcome to Bipolar Talks, a mindful space where we take the time to break down the often complicated and misunderstood world of mental health into clear conversations. Here we believe that knowledge is power, especially when it comes to managing conditions like bipolar disorder, where understanding your own mind is just as important as the treatment itself. Before we dive in, I invite you to like this video, leave your thoughts or experiences in the comments, subscribe to the channel for more insightful discussions, and share this episode with someone who might benefit from hearing it. In today's episode, we will explore a question that many people living with bipolar disorder, or those who care for someone with the condition, have asked themselves at some point. Why is it that even when a person takes medication as prescribed, they can still experience episodes of mania or depression? On the surface, it seems logical to believe that medication should be enough to keep mood swings completely under control. However, the reality is much more complex. And to understand it, we need to look closely at how bipolar disorder works, how medications target different aspects of it, and why one medication alone is rarely enough. To ground our discussion, let me share a real-life story from someone named Jay. Jay is 23 years old, and he has been diagnosed with bipolar II disorder and ADHD. He currently takes 3 medications: Lamictal 300 mg, Rexulti 3 mg, and Adderall 20 mg. Despite this treatment plan, he has faced significant struggles. Over the past 8 months, Jay has been hospitalized 4 times. 6 months ago, he attempted suicide by hanging, which is a stark reminder of how serious this illness can be. Jay's most recent hospitalization happened after a hypomanic episode that initially felt incredible, like a surge of energy, creativity, and confidence. But soon after, it spiraled into a deep, crushing depression. He also shared that every year, around June, he falls into a severe depressive episode that hits him hard and fast. His biggest questions were these: how much cycling is normal while on medication? Should he still be getting this depressed despite treatment? Is it possible that he's still not on the right medications? He also expressed fear of trying antidepressants again because in the past, they made his symptoms far worse. Rapid cycling. Why some people experience frequent mood episodes. What Jay describes is a pattern known as rapid cycling bipolar disorder. Unlike the more typical course of bipolar disorder, where mood episodes may occur only a few times in a lifetime or once every few years, rapid cycling involves experiencing 4 or more distinct mood episodes, whether depressive, manic, or hypomanic, within a single year. These episodes may be separated by short periods of stability, or in some cases, they may come one right after another without any break. To understand why rapid cycling happens, it helps to think of bipolar disorder as a condition where the brain's mood regulation system, something that normally keeps emotional highs and lows within a manageable range, is not functioning as it should. Instead of staying balanced, the system overshoots in both directions, leading to extreme highs, mania or hypomania, and extreme lows, depression. Medications are designed to help bring that system back to equilibrium, but sometimes other factors interfere. For example, thyroid imbalances can dramatically affect mood stability. The thyroid gland plays a key role in regulating metabolism and energy levels, and if it is underactive or overactive, it can trigger mood episodes or make existing ones worse. This is why doctors often recommend regular blood tests to check thyroid levels in people with bipolar disorder. Another factor is the use of certain medications, such as antidepressants. While antidepressants can be life-changing for people with major depressive disorder, they can sometimes destabilize mood in people with bipolar disorder, leading to more frequent switching between depression and mania. This is what Jay experienced when antidepressants made his symptoms 10 times worse. Lastly, stimulant medications, like Adderall, which Jay takes for ADHD, can also increase the risk of mood instability in some people with bipolar disorder. Not everyone has this reaction, and some individuals can take stimulants without any issues, but it is a risk factor worth monitoring closely. The role of medication. Why one pill is rarely enough. One of the biggest reasons why someone might still experience mood episodes despite being on medication is because no single medication treats all aspects of bipolar disorder equally well. The illness has several different phases, and each phase responds best to specific types of medications. The 4 phases of bipolar disorder that treatment typically targets are: 1. Acute depression, where symptoms of sadness, hopelessness, fatigue, and suicidal thoughts are overwhelming and disruptive. 2. Acute mania, where elevated mood, increased energy, and risky behaviors can spiral out of control. 3. Mixed states, where symptoms of depression and mania appear at the same time, making the experience even more distressing and confusing. 4. Maintenance, the period between episodes where the goal is to prevent relapse and keep mood as stable as possible. The problem is that not all medications work for every phase. A drug that is excellent at controlling mania may do little to prevent depression, and vice versa. This is why doctors often use combination therapy, where 2 or more medications are taken together to cover all the bases. Types of medications and their purposes. Medications for bipolar disorder generally fall into 2 major categories: anticonvulsants and antipsychotics, with lithium standing as its own unique category. Anticonvulsants, originally developed to treat seizures, were later found to have mood-stabilizing effects. They help calm the overactive brain signals that contribute to mood swings. Antipsychotics, despite their name, are not just for psychotic symptoms. They are now widely used as mood stabilizers because they can quickly control mania, mixed states, and sometimes depression. Lithium, one of the oldest medications for bipolar disorder, remains a gold standard because of its strong ability to prevent both mania and depression, although it requires regular blood monitoring due to potential toxicity. Which medications work for which phases? The U.S. Food and Drug Administration (FDA) has approved specific medications for specific phases of bipolar disorder. For acute mania, drugs like Abilify, Safras, Vraylar, Zyprexa, Seroquel, Risperidone, Geodon, lithium, Tegretol, and Depakote are commonly used. For bipolar depression, the only approved medications are Vraylar, Latuda, Seroquel, and Symbyax, a combination of Zyprexa and Prozac. For mixed episodes, Abilify, Safras, Vraylar, Zyprexa, Seroquel, Risperidone, and Geodon are used. For maintenance, medications like Abilify, Safras, Seroquel, Geodon, Zyprexa, lithium, and Lamictal are approved. It is important to note that Lamictal, which Jay takes, is primarily effective at preventing depressive episodes during the maintenance phase, but is not strong for treating active depression or mania. Rexulti, on the other hand, is approved for depression and schizophrenia but not specifically for bipolar disorder. This means Jay's current combination may not fully address his illness. Why combination therapy is often the key to stability? Because bipolar disorder is complex, combination therapy, using more than one medication, has become the standard approach for many patients. This strategy allows doctors to mix and match drugs that target different phases of the illness, providing more complete coverage. For example, Lamictal may be paired with an antipsychotic to prevent both mania and depression more effectively. Some medications, like Seroquel, can treat all 4 phases of bipolar disorder, making them powerful tools. However, Seroquel comes with significant side effects, including weight gain and profound sedation, which can make daily functioning difficult. Other medications, such as Vraylar, work well in most phases but may need to be combined with another drug, like Lamictal or lithium, to prevent relapse fully. The reality of finding the right treatment. Finding the right combination of medications is often a long journey that requires trial and error. Doctors must balance effectiveness with tolerability, adjusting doses or switching drugs based on side effects and how well symptoms are controlled. Sometimes the medication that works best is not covered by insurance, forcing patients to try less expensive alternatives. In such cases, doctors may prescribe medications off-label, meaning for purposes not specifically approved by the FDA, if there is evidence that they can still be effective. Jay's experience underscores an important truth. Treating bipolar disorder is not as simple as taking one pill. Different medications serve different purposes, and what stabilizes one phase may not prevent another. Finding the right combination takes time, patience, and close collaboration with your doctor. Thank you for listening to this in-depth discussion on why one medication may not be enough for bipolar disorder. If you found this episode helpful, please support Bipolar Talks by liking this video, subscribing to the channel, sharing it with friends, and leaving your thoughts in the comments. Disclaimer: this podcast is for informational purposes only and is not a substitute for medical advice. Always consult a qualified mental health professional for diagnosis and treatment tailored to your unique needs.